Happy Wednesday, everybody. This is the final day of our conference, and we're just so thrilled again to have you all here and present for these final two sessions, which I'm super excited about. Before we get into that, I want to make sure that we review, just for those of you continuing to do enrollment assistance and seeking to earn your continuing education credits. Those certificates will be sent to you after the conference. We're going to give priority to those who are newly seeking their pre-licensing credits. So we will be sending out those certificates first to that group of folks, and then the continuing education credits and those certificates. They will go to the emails that you use to register. So if you know that there was any error in any of that, do reach out to us, especially Elizabeth Rothy, and she can make sure to help connect the dots on anything that might be not quite right. And similarly, for anybody, not just those who are seeking pre-licensing, we will have that Q&A session on Friday, and the link is on our conference webpage. So please do join. It'll be about an hour. I believe it's from 1 to 2:15. Don't quote me on that. Please do look on our website. The information is there. We have a gift card recipient drawing for yesterday, and the winner of that gift card drawing is Donna Simmons. So congratulations to Donna. As with all the others, after the conference, we will be sending you information over email. So do keep an eye out for that. And the final recipient for today's attendees, we'll see if we can announce it at the end. If not, that one may just have to remain a mystery, and we will alert that person once that drawing is completed. And congratulations to everybody. And then finally, before we just take a pause and make sure everybody has a chance to connect and join for the first session that's going to be starting in a few minutes, the evaluation that I've mentioned over the last few days is now available. If you go into the top right corner of your screen, you should have different boxes. There's been the box that has been for Q&A, a box for the poll questions. There's a box for session information. If you haven't looked in there, that's where just information about the particular session that's coming up, a description, speakers, moderators. In today's session information, both for this one this morning, as well as the one that will come a little bit later, there's also a link for the evaluation survey. Click on that, you can fill it out, and it's pretty short, just a few pages, basically just asking you a few questions about what your experience was like, and please do share that information. We use that every year. We reflect on it. We use it to inform the content and overall format for the coming year. And so this is a chance for your voice to be heard. We love to hear both what you appreciated and what things you would like to see differently next year. And yeah, so click on that link and give us your feedback. Okay, well, let's take a pause, and we'll come back in about 5 minutes, and we'll start our next session. Thanks, everybody. And we're back. All right. Well, let's get moving. So I'm happy to introduce our next session moderator, Caroline Gomez-Tom. Many of you know Caroline. She is just so present in so much of what Covering Wisconsin has done over the years and currently. So Caroline graduated from the University of Wisconsin-Madison with a double degree in political science and social work. She also holds a master's degree in social work with a concentration in social policy. Currently, she works for Covering Wisconsin as an enrollment network and accessibility manager. During 2019 to 2021, she worked for 16th Street Community Health Centers as the Director of Patient and Community Engagement. Most recently, Caroline won a special election for Milwaukee County District 14 Board Supervisor, serving the city of Milwaukee South Side. Caroline is currently on the board of the Milwaukee Latino Health Coalition, Children's Health Alliance of Wisconsin, and Kids Forward. In 2022, she was elected the president of the City of Milwaukee Board of Health. And in 2016, she was honored as one of the 40 under 40 leaders in minority healthcare by the National Minority Quality Forum. So excited to have Caroline leading this session. And Caroline, I'm going to hand it to you.
Wonderful. Thank you so much, Allison. And I am ecstatic to be here in front of you all with such an important set of sessions that we've had over the last several days. I'm excited to be able to share one of my favorite topics, which is building partnerships, building relationships, in a session called Teamwork Starts with Building Trust, Income Maintenance Agencies and Community Partners Working Together. Let me see if I can get my slides to move. So before we get started with introductions, I want to just briefly mention why partnerships are so essential to the work that we do and why they should be intentional. So ongoing relationship building in our work is crucial because if we are not working collaboratively, this work is impossible or near impossible. As we develop relationships with one another, as we get to know our communities, as we get to know what each one of us does in our communities, that's what builds the framework, the network, the connections, so that we are building what we keep talking about in regards to a safety net, so that folks who need to renew their Medicaid, that need to get connected to other forms of coverage, that need to get connected to healthcare, that they do not fall through. And the stronger we can weave that net, the more we protect our communities and keep them safe. And so what is a good partnership relationship? Well, I view it in a couple of different ways. One is that they're ongoing and ever-changing. And what I mean by that is that they take time, that it's not something that you meet with someone for the first time and you give them the spiel of your organization and then it's done, but rather you are developing and touching back and sending things that make you think of that individual, or reconnect with them when you remember that something was coming up that you could support them on, or vice versa, just figuring out time to meet up just to check in to see kind of where things are at based on what their priorities are and what your priorities are. And I mean ever changing because relationships are fluid, and you know, who knows, maybe this presentation could also support your personal lives, because the thing is that relationships don't vary. They in terms of how they develop, they may vary obviously in formal versus non-formal, or close relationships versus professional relationships. But the way you get there, the way you can steward good collaboration is all in this process of building community. Relationships should be bi-directional. So what that means is that they support one another. I may be helping you with something and you may be helping me with something, but they're not meant to be all the time bi-directional. And that means I'm not becoming your friend or your colleague or your partner because I need you to help me. Because if that was in it, that's more of a business transaction. Am I right? That's not collaboration. That's not partnership. So really it's looking at what can I learn about this organization or this other individual, and what are my skills, strengths, time, energy that I can bring to that relationship, whether that's now, whether that's a month from now, whether that's a year from now, whether that's 10 years from now. And once again, that can be ever changing. And ideally, they're authentic. So once again, not transactional, but rather, how can I be with this organization, with this individual in the moment to make sure that I'm able to support them, and then they in turn are able to support me. Many good relationships will share a goal. And what I mean is that we have the same goal right now of helping folks, as many folks as we can across the state, in renewing their Medicaid and making sure that they connect to the coverage that they're eligible for. And it's important to know that by sharing this goal, that doesn't mean that we have the same reason to have this said goal, yet we all are trying to deliver that goal. And so it's a great way to know that you're in a good partnership with another organization or another individual when you share a goal, but understand that they may be coming from it from a different perspective, and that's okay. And then, of course, and my favorite, a good relationship, a good partnership, a good collaboration is centered in transparent communication. And so that means if you're unsure of what that person or organization meant, you communicate that and you work with one another so that you understand me and I understand you. And through that, it only fortifies our relationship, our partnership. So with that, and keep that all in mind as we then transition to the wonderful introductions of my colleagues. I am so very excited to introduce to you my lovely colleagues that I now have been in partnership with through this work for over the last 10 years and longer for some. So Maciel Gomez, I know you have seen her quite a few times. She works with the Department of Health Services of Wisconsin. She is the Enrollment and Outreach Coordinator. But more importantly, she has been a wonderful and amazing colleague, partner, and really liaison to the community from the state government. And without her, I don't see how we're able to do this work well. And I am just very honored to be not only her community partner, but a friend. The next, I'm excited to share Lindsay Schwartz-Nichols, who is a social worker at La Crosse County Health Department, and where she also serves as our Western Regional Enrollment Network lead. Lindsay educates and assists over 200 households per year in establishing and maintaining benefits. And she's earned her bachelor's in science and sociology with a minor in Native American and rural social work, and with an emphasis in social work from the University of Wisconsin-Stevens Point. And then finally, Katie, who has a sweet soul. I'll just lead with that. I really enjoy her energy. She is the economic support manager for Monroe County with 10 years of economic support experience between Monroe, Clark, Jackson counties. And she works with the Western region for Economic Assistance Family Team, where she specializes in Spanish, outreach events, pre-certification tool project, Afghan guest project, cool cause claims, as well as immigration cases within the Western Regional Economic Assistance Family Team. and she's dedicated and passionate about economic support programs and works to make a difference in the lives of people in the Western region. I'm very honored to introduce you to these three wonderful women. And then I will then transition to my lovely colleague, Maciel Gomez, as she will go into the wonderful work that she does in connecting partners with the income maintenance agencies.
Thank you, Caroline. I truly appreciate such a wonderful introduction. Good morning, everybody. Thank you for having me again today. I'm just going to go ahead and cover a brief overview. I'm sure many of you have already heard this, but in respect for the recording that we're having, I want to make sure that everybody has the same understanding of what the unwinding means for everybody. So unwinding is a term used by our federal partners to describe the steps states Medicaid agencies must take to replace temporary policies that were established during the COVID-19 emergency. The unwinding reestablishes our regular eligibility, enrollment, and benefit management processes, which I refer to often as the routine operations that were in place prior to the COVID pandemic. Next slide, please. Now, the goals of the Wisconsin Department of Health Services have been to implement a successful return to routine operations and to make sure that Wisconsinites continue to have healthcare coverage. Wisconsin DHS staff and partners have been working together to prepare as best as we can for the last 12 months. To make sure, actually, we've been preparing since, I want to say, mid-2020. So to be intentional in the process of ensuring that the 12 months of the unwinding would take place in a manageable process. In this process, DHS continues to work with income maintenance agencies, aging and disability resource centers, also known as ADRCs, and managed care organizations known as MCOs, HMOs, ICAs, and other partners to assist our members to ensure that they are able to meet our vision in minimizing negative impacts on the unwinding process for our members. We are also following CMS guidelines to meet expectations of the unwinding. With that, we have asked our partners to go ahead and support us to ensure members update their contact information by using Access and MyAccess, to assist members to complete the renewals online, and also to ensure that if they no longer qualify for Medicaid or Badger Plus, to transition over to whether it be healthcare.gov or other health insurances. I'm pleased to say that in the fall of 2021, we established the simply because of all the complexities that take place with the unwinding effort, it was important to ensure that members completed their renewals on time, and we worked eagerly with our partners to reach out and support our members. The goal, obviously, is to ensure that members either maintain coverage through the PHE and also to either transition to completing the renewal or to the marketplace or to the employer-sponsored insurance once the renewal came up. Next slide, please. So the membership of the unwinding is made up of several organizations, and here is just a small sample of who actually has joined our task force. We have Covering Wisconsin, ABC for Health, disability advocate groups. We have also the FQHCs, HMOs. We have the tribal agencies, and we also have the healthcare systems that have joined us in our efforts. That must lead us to our first poll question, Caroline.
Yes, so we'll be going into our first poll question. And
I can read it if you'd like.
Yeah, sorry, I'm not seeing it.
Yeah. So it looks like people are already starting to vote, which is great. The question is, how often do you contact or partner with your local IM agency? And the options are every working day, a couple times a week, once a month, or not at all. So we'll give that maybe another, 15 seconds or so. And that can be shared to see the results.
All right, so it looks like most are working with their local IM agencies, but I'm seeing more once a month, once a week, several say a couple times a week. And I know 7% is probably our navigator community and enrollment assister community, where they're working with them almost every day. Wonderful.
So just to give a little bit of background of what an income maintenance agency is, or a tribal agency is their role is to go ahead and answer questions about eligibility. They can assist folks in applying for benefits. They conduct food share interviews. They process applications. They change eligibility for benefits. They process verification. You can get all of these services at your local income maintenance agency in your consortium. Each of them has their own call center and contact information. And I do believe in the next couple of slides, we have listed the link for all the statewide agencies so that you can find your local agency easily by clicking on that link. And I pretty much went over this particular slide, so sorry about that. So given that IMs are extremely important with the work needed with the unwinding efforts, the task force and the membership of the task force established an IM partner work group in early 2022. And that particular work group focuses on connecting IM agencies with partners and stakeholders to establish streamlined communications and understanding of what the processes are and needed to do the unwinding work. In that particular IM partner work group, we collect stakeholder and IM agency input for the department and for other IM meetings. The group is responsible for sharing and discussing and elevating any communications or communicating best practices on ways that IM agencies or stakeholders can interact with one another to aid our membership during the unwinding process. And more importantly, any issues or any concerns or refreshers that are needed during this unwinding process, we have discussed those not only at the unwinding task force. However, we've also brought those issues and asked our regional enrollment networks to go ahead and convey some of those concerns or needs so that everybody is prepared as the work. Next slide. So conversation we had, the group itself was able to identify some helpful best practices. They were able to discuss what would be needed when an individual called the IM agency, what how to provide verification for their case, where it be providing proof of verification, how to request backdating, if an individual needs assistance with translation services. So many of those ideas and those discussions, what we did is we pulled together and identified some resources that would help your CACs who are attending this conference, the navigators, anybody who's really assisting folks with the unwinding. We developed a partner resource guide. Now, it's important to note that this partner resource guide helps individuals streamline the efforts for the unwinding. It is not a document that should be shared with our members themselves. However, I would recommend to have this document shared with your colleagues who are enrollment assisters or navigators to ensure that you have at your fingertips information that could be helpful as you encounter a member that you're assisting either with the renewal or applying for a different kind of benefit during the unwinding process. So should you have questions, feel free to go ahead and contact your IM agency. As I mentioned, this is the link that lists all of the statewide IM agencies, and you can find your local one by clicking on that link. And also, please utilize the DHS Forward Health Partner inbox. That inbox is managed by myself and a few of my colleagues. If you have questions regarding the unwinding or who to contact, or you have a difficult case where you have already exhausted working with the IM agency and need additional assistance, feel free to go ahead and email us at that email address listed on this slide. Caroline?
Wonderful. Thank you, Maciel. I don't have any questions currently in the box, but I wanted to just ask briefly. So in terms of the strategy with Department of Health Services and the Medicaid unwinding, what was so important of having this venue, this opportunity for partners to be at the table when working with the income maintenance agencies?
Good question. I feel the importance to go ahead and gather and revamp some of our processes. And when I say revamp, it's really essentially refreshing ourselves on what the renewal process is and how do we interact with IM agencies was needed, simply because many individuals have not had to do a renewal or get in contact with an agency to access their healthcare, because healthcare had been open and ongoing with continuous coverage since March of 2020. And because of the pandemic and coverage throughout, I've had healthcare program for the first time. Loss of businesses, or they no longer were employed and they needed healthcare during the pandemic, that they applied for Badger Care Plus or Medicaid. And if they did that back in early of 2020, they never experienced a renewal, and it was going to be a completely new process for them. And with that, Caroline, not only do we have new members with Medicaid or Badger Care Plus, we also had a new workforce that was gearing up to assist. And in order to streamline efforts, not only for the membership who may have never experienced a renewal or interacted with an IM agency before or utilized access, we decided that we would not only the membership understand what it is that needs to be done by distributing that helpful resource guide with local RENs and such, but also bear in mind that membership of the RENs or the CACs were also new to the workforce and needed to either be provided refreshers on how to go ahead and complete the renewal, or refreshers on, or just simply have a better understanding of what the process is, so that they can aid the members as they did the renewals or interacted with the agency to request different benefits. Does that answer your question?
Oh, absolutely. And I'm glad that you touched on the really just the transitions with the workforce over the time of the pandemic and after. I know that many organizations, many different sectors even, are experiencing like shortages and staff, and just a tough time bringing folks up, onboarding. It's a very competitive workforce right now, and that's even more reason to be connected, because if there is transition, if there is new folks, both on the IAM agency side, but as well as our enrollment assister side or our community partner side, it makes it that more important for us as organizations and individuals to be connected and to have a place where we store all of our information and make it accessible and available so that we can catch someone up who's new in no time. Wonderful. And so I do have one question, and then we'll leave it at that. Are there any solutions being considered to combat the long wait times in assisting consumers as they process their renewal applications?
Good question. When we were planning for the unwinding process, we recognized that many individuals were going to be in need of help. We recognize that folks might want to call the IM agency and ask what's the status on their case and things like that. So in order to go ahead and prepare for the unwinding, we made sure that we did some enhancements on Access and My Access so that we not only had folks update their addresses and their contact information so that we could reach them when we needed to let them know when the renewal process was starting for them. But we also have encouraged our partnership and our members to utilize Access and My Access as best as they can to complete the renewals and to manage their benefits. The My Access app, if that is downloaded on a smartphone, an individual can go ahead and take a look at what the status is on their application. As their verification been processed, they can submit verification through the app. So there's many ways that they can go and take control of managing their case, completing the renewal on access.gov, .wisconsin.gov website, and then just monitoring it, selecting the push notifications on the My Access app so that they can be in tune on what the status is. That would hopefully free up those phone lines for individuals who actually have to talk to a worker, have to talk to somebody at their IM agencies. What the goal was to make sure that individuals who need to do the renewal and needed help perhaps could be assisted by a CAC or a navigator in navigating the Access program, especially if it's new to them, but to allow the phone lines to be freed for those individuals who actually had to call the IM and either explain why it is that they could not provide a verification that's needed, or ask for assistance in possibly transitioning from Badger Care Plus to EBD Medicaid. So those were the reasons why we really increased the utilization of Access and My Access. Now, to answer your question in terms of times of day, when to call, the other enhancement that the department has done is we've implemented something that is called the callback feature. Now, if an IM agency has longer wait times than I believe it's 5 minutes or more, the callback feature is enacted, and a person who calls in is given an option to either they can wait on hold while they're live on the call, and they will be answered in the order that they are in the queue, or they could select the callback notification, the callback feature, and the system would go ahead and call back that individual who is coming up to speak to a worker. Now, available at first part of the call, individual sits on hold for a while and they would like to select the callback feature. Unfortunately, it's not available to them. However, I do understand that there are circumstances where you felt you could be on hold for a little bit, but then somebody came to the door or something that may have happened where you need to hang up the phone and would like the callback feature. You could potentially call back that IM to go ahead and have them call you back. Call into the IM again, select the callback feature, and have them call you back. But those were the few items, and I think they were pretty substantial. Enhancing access and my access, allowing for the callback feature to assist with the high call volume. But please bear in mind, we started the unwinding process in the end of May of 2023, and currently we are in September. I personally suspected to have high call volumes for the first 6 months of the unwinding, simply because there is the need and just the need for confirmation on parts of our members wanting to call in, verifying where are they at on their enrollment, on their renewal or their application. So I just ask you to please understand that our IM workers are working, as well, but they're working as best as they can to process these cases and to be patient, and also utilize the callback feature when you can. Answer the phone when they call back. I know that sometimes the phone number may say unknown and may not show up as the number, the caller ID from the same number that you called in, but just be proactive on answering those calls when they do come back. Caroline, I hope that answers that question.
Absolutely. And then I will just note the link on this current page too, is that as you're building your relationships with your local IM agencies, this is a resource to their operational context. So if there are technical issues, obviously step one is to work with the call center, the representative on the phone, building relationships through your enrollment network, which we'll get to in just a moment, to get to know your IM agency leaders. And then I think the third route is to then email DHS Forward Health Partners when you have issues that more so become trends, or you're seeing it not resolved at the IM agency level. So I will go to the next slide. Thank you so much, Maciel. And we'll have you back in a few moments for the end question and answer. But now we will go to enrollment networks. And I am really glad to be able to talk to you about enrollment networks. This is a collaboration between local stakeholders, the state county agencies, facilitating improvements on health insurance outreach, promotion, direct assistance, program administration, and education. The enrollment networks were originally founded in Wisconsin. I am not sure of other states that actually have a model like this, where we brought partners together with the idea of sharing information, outreach coordination, and then building regional and culturally relevant messaging. They were originally created during the first years of the Patient Protection and Affordable Care Act, right before the first open enrollment period, in partnership with the Department of Health Services, Covering Wisconsin, and the Wisconsin Primary Healthcare Association. And we took to the road where we drove across Wisconsin and kicked off this idea of bringing partners together who all were asking, what do we do around this new law in our state? And brought them all together to start talking about, well, how can we work together to make sure that we understand this law, we're able to prepare for this law, and then we can help people get connected to the resources that are available to them. And from that, we were able to build these regions off of the Income Maintenance Agency regions. So fast forward now to 2022, 2023, we have brought enrollment networks back. There were two that stood the test of time and were able to maintain their networks, which were the East Central Enrollment Network, kind of in the Fox Valley area, and then the Milwaukee Enrollment Network. But because of not necessarily having funding or long-term support, and the ACA becoming more normalized and standardized in how we prepared for each and every open enrollment period, the remaining enrollment networks kind of dissolved. And now here we are, once again, in this moment with the Medicaid renewal unwindings, and we have been in partnership, Covering Wisconsin and the Department of Health Services, to bring these models back. And now with support from the American Rescue Plan Act dollars and support once again from some of our fantastic colleagues and partners across the state. Oh, sorry, I went backwards. And so the networks help keep local partners informed about policy change. They help build our enrollment assister support and capacity infrastructure across the state. We're able to streamline outreach activity. So because I know what you're working on, then I'm not replicating that. Or if we know that there's something big coming up in the community, we can be present and active so that we're able to talk to as many people as possible. And then even more importantly is making sure that our message is relevant to the folks that we're trying to reach in our community. And a great model of that is some of the resources, the flyers, the postcards that we utilize at Covering Wisconsin. Many of those are either directly tested with some of our key partners, or we bring them to the enrollment networks to receive feedback and make sure that they will resonate with the people that we serve. And then I think the most important and intentional piece of enrollment networks is to have that conversation pipeline between the Department of Health Services and other key statewide partners and what is happening on the ground. Because without knowing what is happening in our communities, the state would not be able to pivot, improve upon, transition their resources. So they really are serving their Medicaid members as well as our communities. And so here I get to promote my wonderful colleagues across the state that serve as the enrollment network leads. If you are not already participating in your local enrollment network, I really recommend and can't encourage enough for you to stay as a part of the conversation, a part of the planning, the strategizing, and really the best way to reach a wide net across the state and protect our folks that need access to this important coverage. I will also highlight that you'll see that we have our newest enrollment network and member who is Yu Lee from the New Hmong Professionals. And she is our newest enrollment network lead, leading the Hmong Enrollment Network. And we'll have her kickoff on the 27th of this month, which is next Wednesday at 1 o'clock. And if you'd like to join any of these enrollment networks or Yu Lee's enrollment network, please look to the links. There is a link to add yourself to any and all of the enrollment networks across the state. So now we'll get into poll question number 2. And may I ask Allison if you could also read it, please?
Sure thing. All right, so that is now open. And the question is, are you connected to your local enrollment network? And we got, yes, I am connected to multiple enrollment networks. Yes, I attend just one meeting when I'm able. No, but I am going to join my local enrollment network after this conference. And no, enrollment networks are not relevant to my work. So we'll give that another 15, 20 seconds for people to get a chance to chime in and share where they're at with enrollment networks.
All right, wonderful. Well, I'm glad to see that the majority of our folks are participating. And I like to see that the majority or a larger percentage are attending regularly. And I hope that you all continue to participate. And for the folks that haven't joined just yet, I hope you plan to do so because we did, most of them meet bi-monthly, some meet monthly. But because of the conference, many of our enrollment networks did not meet during the month of September. So we'll be starting anew in October. And I know that the way that these work is through people power. So with you at the table, you make these enrollment networks stronger. And because they're regional or because they're serving a particular community, they're meant to look different. They're meant to adjust and specifically touch on issues that are important to the group of people at the table. So if you want something addressed, you're able to bring that in front of the group. And so I hope you join. We want to see you there. And I just got a question, will the Hmong network meetings be in Hmong and English? And that's a wonderful question. So that will be one of the discussion points of the first kickoff meeting. And I hope that you attend to lift your voice and be heard so that we can see what makes the most sense for that community. All right, so next I will transition really to a beautiful story of a partnership between the Western Enrollment Network and the Western Region for Economic Assistance, which is the IM agency for Western Wisconsin. I'll let Lindsay and Katie kick it off.
Great. Thanks so much, guys. We are excited to kind of highlight and showcase what we have been doing over on the western side of the state over the past 10 years and actually even longer than that. So we'll go ahead with the next slide. So this says partnership is 10 years in the making. I think that would be our ACA partnership. But really, we have been working together for over 20 years. Just a little bit of a background. I'm the social worker in the health department, and I started back in the summer of 2002, and we were one of the first, like the pilots with covering kids and families at the time, now covering Wisconsin. So been doing Badger Care outreach and connecting community members to resources in the community and healthcare, and a lot of outreach over that time. Fast forward, we're going to go ahead and say there's this new law coming into play, ACA, and it's new. We don't know anything about it. A lot of people are very unsure, unsteady. We're all learning together. And ultimately, some extra funding was brought into the consortia to assist with this. And what our local consortia ended up doing is not only hiring some LTEs that were trained as CACs, but they felt that there was value in hiring a coordinator. And ultimately, we got a call in the health department that says, we'd like to buy Lindsay's time for a year. And we would like her to coordinate the efforts in our 8-county service area. I've only worked in La Crosse County. I don't know anything about the other 7 counties for services and things like that. And so walking into this ACA meeting that we had brought all community members together, and I recall it as just like yesterday. There were a lot of people there. They were not people that I worked with in the past. They were not ground level workers. I'm out at the food pantries. I'm at the free meal sites. And the people that I walked into that room with were economic support staff that were management, human service managers from the other counties. It was government relations from the local healthcare institutions, a lot of agents and brokers. And I was not familiar with this, but let me tell you, quick learning curve. We got familiar real quick. And over that next 12-month period, we worked to offer enrollment opportunities across all 8 counties at least once a month during that open enrollment period, and keeping that communication open with the clientele that we were serving, the community, as well as the agents and brokers, our navigators, our CACs. So fast forward, now we're going, things got a little quiet. Caroline had mentioned funding had decreased or went away. We went ahead and we didn't have ongoing meetings anymore, but we kept a listserv. So when there were changes and policies and things like that, educational opportunities, we kept our listserv going so we could share that information out. But we really prided ourselves on a handful of really good relationships, not only with our IM agency and our IM staff, but also with those agents and brokers in the community, because I felt like I could be the link between them and their client, that maybe their kiddos were dropping to Badger Care and mom and dad were going to end up on the marketplace and such. So kind of a heads up on that. That relationship with the agents and brokers maintained through the past 10 years. Fast forward, okay, here we are. It is 2022. We're reinvigorating the RENs, bringing people back together, and it looks really different for us because, as somebody had said earlier, like ACA kind of normalized. And what did that mean? We kind of got quiet for a while, but now we've got this unwinding with Badger Care, and we need to make sure that the clientele that we're working with and our community members that are going to be affected are able to get their notices and understand what's happening. And so we kind of bring everybody back together again. And this time it looks really different. We still have our agents and brokers at the table. We still have IM. We're actually really IM heavy at our REN meetings. We have good representation from our IM. It's encouraged for the supervisors to attend to hear the feedback from our REN partners. But we are really, really heavy in community partnerships, which is really different. The government relations people that were at our meetings 10 years ago, they've kind of like fallen off a little bit. And we're really right now about making sure that everybody gets connected to services, and that they, if they're eligible, that they remain eligible. So we have a lot of attendees, members of our REN that are ground level workers. They are the first point of contact at local agencies. They are the person, and what we say is, you don't need to know everything. We're not asking people to know everything. Ultimately, is we want you to be able to connect people to the right locations. So when we reactivated our REN and started meeting, our REN meets every other month. It was a kind of a learning process, because some of the staff, like people had mentioned earlier, not only our IM staff might be new over the past couple of years, but community partner staff have changed as well. So making sure we get the right people to the table, and always asking like who's missing at the table, because we really want our REN to be inclusive of our service area, and to make sure that we can promote the message from DHS, whether that's update your address, open your mail, download the My Access app. We really want to support our IM agencies and to take workload off of them if we can be that kind of buffer. And with our REN meetings right now, I appreciate that DHS is at the table, and that either our manager from our consortia or the assistant manager are attendees, so they can go ahead and provide local feedback, and they can hear the feedback from the community partners that are at the table. And then next slide. A couple ways to show a recent collaboration. We have done a mailing back in May, I believe, to all faith-led communities, organizations within our 8-county service area. We put in information, DHS approved information, flyers, things that we can order right off of the DHS website at no cost. For Badger Care, Food Share, we partnered with another section in our health department to also supply information on WIC and the Wisconsin Well Women program. So really working together with others. Most recently, we've sent the same mailing out to food pantries, free meal sites, just local food resources within the 8 counties, and just letting people know that we have local help available. You're not in the boat alone. You don't have to go at it alone. If you've never done a renewal, it could be very scary. Sometimes people are turned off from the mailings and such. We don't want that. We're here to help. We want to go ahead and work together. And we're always looking in those mailings. It had like an opportunity, like join our REN, like come and share your concerns. Let us know what you're seeing in your communities. Like I said, our REN meetings, at our first meeting back in August of last year, we asked our people at the table, and we continue to do it, like, what do you want to get out of these meetings? We don't want to meet just to meet, but what do you want to get out of these meetings? And every topic that they've suggested, we've been able to cover. And when we started just kind of getting our feet wet and everything, we had a longer meeting. It might have been 1.5 hours, 2 hours. Now we're back down to an hour meeting. Just depends on topics that need to be covered during that time. I'm going to let Katie take the next few bullets.
Okay. So one of the big things that has been really helpful with working with our regional enrollment network is that they've been able to really help lessen our call volume. We knew that things were going to get a little bit busy, a lot busy actually. And so what happened is, with Lindsay and the work that she's been able to do, and along with the partners, it's really helped. There last month, I believe we were one of the only consortia, if not the only consortia in the state, to actually meet our call average speed of answer. And that is huge credit to those partners going out there and doing the education, the teamwork and collaboration with Lindsay and everything, so that our communities were fully aware of what was going to happen and when they needed to act and that kind of stuff. They were highlighting that using the access.wisconsin.gov for those healthcare renewals, people haven't had to do their healthcare renewals for 3 years. And so I always say, worst case scenario, somebody shows up to the pharmacy and all of a sudden they don't have the coverage they've had for 3 years. We didn't want that to happen. Or somebody shows up at the store and their food share is a lot less than it was before. We just don't want those situations to happen. And so having Lindsay and the team really promote those methods and kind of help be the on-the-ground force for all sorts of different partners within our community and within our consortia has been very helpful. I know at one point they had asked the Western Regional Enrollment Network members had asked for a presentation on Food Share and on Badger Care. So we went out and we did a presentation on Badger Care 101 for the enrollment network members, but then we also did that for the school districts last fall when people were first coming back to school, just to make sure that they were aware of what was going on as far as renewals, as far as food share. And additionally, when the supplement to maximum for food share went away, we were out there working and presenting and trying to get in touch with the communities so that they were aware that, when they were used to getting $250 a month and their benefit may have gone as low as $23 a month, that they didn't show up at, the store with a cart full of groceries and all of a sudden have that really embarrassing moment where they don't have enough money on their food card and things. So it was really just a great team effort. on the education of the community and those partners. Now that we're back at fall and school is back in session, we are looking to do another round of presentations for our school districts. Last round, I believe we had 80 something different people from the school districts in our 8-county consortia. So we had excellent participation from those school districts. And it was just incredible to be able to get that word out, because these are the people that are on the ground with these kiddos, with these families on a daily basis, and they're able to point them in the right direction to the resources. And so the partnership has done a great job, getting all of those stakeholders from different areas in. And then the other thing that we did was we partnered on that community outreach. So as I was kind of talking about with the school districts and with the REN partners, that kind of stuff, we actually had some of our Western region staff go out to, there's a little city in our area called Norwalk, and it has a very heavy Spanish population. So not only were we able to send out staff to be there, economic support workers to be there, we sent out bilingual staff to that, so that they could have, the equal footing in each language for their members to get that information, so that we weren't just giving them information in one language. We were really reaching them at their level, and they had staff that they could ask questions if they had, that could answer their questions in their own language. And so it's just been a really incredible community outreach and partnership that has really helped us with this unwinding process.
So I think this is where I come in and just share the last bit of resources before we get into the final Q&A. So let's build some relationships. Let's build some partnerships. One of the best ways, as I will reiterate and reiterate again, is to get connected to your enrollment networks. And so this is the link that will allow you to do so. As we have shared, building relationships with your income maintenance agency partners at the local level is important. So we have a link to those operational contacts in your area. If there are trends and concerns that you're seeing on the ground, getting them flagged up to the Department of Health Services and their Forward Health Partner email. And then in any case, and in any situation, if you don't know where to start, please feel free to give Covering Wisconsin a call. And here I connected my email address to this link. And of course, keep calm and unwind on. Katie said this as we were preparing for this, and I was like, yes, partnerships allow you to keep calm and unwind on. So with that, I wanted to see if there's any other additional questions and see how else we can help support you all as you're preparing your relationships, your partnerships, to make sure that you're serving your community to the best of your ability. I see one, are IM agencies regularly involved in all enrollment networks? I'm happy to take that one, actually, since I attend every single one of our enrollment networks and support our wonderful enrollment network leads. And it is actually something that we have committed to integrating our partners, both with the Department of Health Services, obviously supporting each of our enrollment networks, and then our IM agencies, knowing how crucial their role is in this Medicaid unwinding transition, to have their seat at the table. And so we have been lucky in getting every single enrollment network connected with their local IM agencies, and in some cases, multiple IM agencies. I think our Northeast enrollment network has 3 IM agencies participating because we serve so many different counties. And I love someone put a question in, are we unwound yet? Not yet. As we know, this will go through June of 2024, which also makes it important that we're staying connected, because I know that self-care and burnout has been a theme across this whole conference. And when you are feeling tired, exhausted, feel like you don't know if you can take the next consumer or the next client, that's one of the beauties of partnership. You can share that with someone that you've built camaraderie with, and they can say, I got you. I have your back. And we already see this naturally happen through our enrollment networks, through our enrollment assister collaborations. And I see it definitely through my own navigator team here at Covering Wisconsin. But the stronger we can build those relationships and expand them, the more we have when we need to help our friend. So I am not seeing any other current questions in the moment, but I want to bring it back to Katie and Lindsay. What are some of the immediate benefits you have seen in partnering with one another, and why was it so important from back when 2013 for you to participate, Katie, in your local enrollment network? Because back then it wasn't necessarily a requirement for IM agencies to participate, but definitely something that you were committed to.
Yeah, in 2013, I was a brand new economic support worker. I just hit my 10 years, woohoo! And so with the Affordable Care Act going on, there were so many different changes and things coming at us, and really having the partnership out there, having the Western Enrollment Network to help answer some of those questions, it really cut down on our call volume. And I think that's an exact example of what's happening right now is, yeah, we are noticing a higher call volume and things, but it's much more manageable. And I think that's because of the hard work that our enrollment network has done. And so, getting out to the community and educating them and just showing them what they can do and that we're here to help and what resources are out there has been a huge part of that. A part of that success. It really is a partnership, because without our regional enrollment network, I don't feel like our call volume would be as sustainable as it is right now. And our workload, we'd have way more calls coming in, lots of questions and things like that. But with the enrollment network in place, they're very helpful at kind of catching those questions and doing the education piece. Which allows our staff to focus on their work more. And it's just a successful partnership.
I also wanted to go ahead and tag on with that, Katie, is that we, as myself as the REN lead, being that go-to for the REN members. So they're not the ones that are necessarily calling the IM if they have questions or concerns. A lot of them we have maintained that partnership and relationship with over the past 10 years, even though through more informal channels, not standing meetings and things like that. But if they have questions or concerns, a lot of the times those agents and brokers will call me directly, and they'll float some ideas past me and say, hey, I've got a tough one, or looks like kids are going to drop to Badger Care. Can you help? And how can we partner and be that intermediary sometimes between the agent and broker and their clientele that they're serving and the IM agency? And how can we work together that way? And that relationship, it's wonderful, not only between myself and the IM, but myself and those local agents and brokers, navigators, CACs, assisters in general, I should say. But to go ahead and field some of that, so we're not clogging the call center lines with maybe it's an easy question or an easy answer, or I can just go to Katie or I can go to another supervisor and say, hey, I need a little bit of help here. And they are more than happy to go ahead and be that person to support the work that we're doing in the community.
Fantastic. I do have another question for you, Lindsay and Katie. Could you talk more about the outreach and assisting of consumers who are English language learners?
Yes. So Spanish is what my bachelor's is in. And so that's kind of my one of the things that I get really excited about a lot of things, but reaching out and helping people that English is not their first language, whether it's Hmong, whether it's Spanish, whatever language it is, just recognizing that we want everybody to have that, that equal footing and that equal shot. Especially these parents that might have kids that are able to get these benefits and things, we really want them to understand the process so that everybody is able to get involved with these programs. So it's making sure that our documents are available in multiple languages, which a lot of times is a DHS requirement anyways, but also making sure that it's at a level where people can understand what is being read and that kind of stuff, and putting our Spanish workers out on the ground in some of these areas has been incredible, because that means they can get their questions answered. And like I said, questions answered in their own language, and that kind of stuff. There's not an intermediate interpreter when we have bilingual staff that can do it. And so it's really that one-on-one thing that the worker is talking to the customer directly, and they're having a great interaction, and they really get that understanding, and they really understand that we care and we feel for them and we want to do whatever it is that we can. So just making sure that we're looking at cultural competency as well, in getting the information out, and reaching them at whichever language, whatever level they're at. Just meeting them where they're at, I think, is the best part of it.
And it really was just
Absolutely.
an ask. Like, we were going to a lot of mobile food pantries and drive-through food pantries, and handing out information about the unwinding and making sure that addresses were updated and things like that. And knowing that we were going to a community that has a higher Spanish speaking population, we wanted to make sure that we could serve everybody. And I just asked IM, like, hey, this is what we've been doing in some other communities. We're going to this community. Is there a chance that you could send one of your staff with us to help us out? And they sent two. So, like, it was fantastic, you guys. And so, I mean, they could have absolutely said no, and that's fine. I understand that there's a lot of things on people's plates, but literally, it was like a 2-hour window, and they were like, absolutely, let's get this done. We want to serve our community. And it was great for the IM workers too, to get out and say, like, hey, I'm the voice on the other end of that phone. So when you have questions and you call in, it could be me. I'm a real person. I live in the community in the area. I'm not at a call center, in another state or anything like that. I'm your neighbor. And so that has been fantastic. Fantastic. All I just say is, like, what's it hurt to ask? Like, all they can do is say no. But in this situation, like, above and beyond. So we are so appreciative of that relationship.
I think that's the thing.
Well, and I would say too, oh, go ahead, Katie.
It's in our workers' hearts, and they want to go out there and they want to do that. I had several volunteers to actually do that, but I sent my 2 Spanish ones because I was like, they're going to do the best in this situation, because it doesn't matter what language, they can do English and Spanish. But it's in their hearts, and the staff recognize that these are their communities, these are their people that need help and need this assistance and need the education and whatever. And it's a great opportunity for them to step away from the keyboard for a little while and see the true impact of the work that we do. And again, without this partnership, there's not a way that, we would have been able to kind of get that going on our own. We had, we just wanted to make sure that the community is aware we're here and we're ready to help.
So powerful. I think what I am most impressed by is that this energy of collaboration, but also dedication to the community, really not just is a good thing to do, but really it adds to how you're able to help the community. I feel like it informs the work of your call center by being able to be present in the community as well. And I just applaud you. Really, it's quite the example of the work that you all are doing in the Western region. So I know we're getting close to time. So what I want to do is just end with at least one last question. And this kind of goes back to the start of our discussion around good partnerships. When you are starting a new partnership with a new organization, a new colleague, a new person, what is your, lack of a better word, pickup line, but what is the best way for you, or how you have started a conversation with a new potential partner?
I think just letting people know that we're on the same team. Like, we might work in different organizations across town from each other or in the next county, but that we are on the same team and we want the best for the clientele that we serve. And how can we do that? We worked with a local food pantry to go ahead and put postcards in, just like reminding people that unwinding is happening, and to, like, the DH message at the time was to update your address. And that ultimately we want the best for the clientele that we serve. We want a healthy community. We want those who are eligible to utilize programs. We want them to be healthy. We want their children, their household, their family. We want a healthy community in general. And so, like, what are you already doing that we can partner with, or what are we doing that you could that we could take some workload off of your plate too? So how can we work together to just best serve our community members in various aspects, not only healthcare?
Absolutely. Katie, Maciel?
I think my thing is I'm very proactive about economic support. Actually, we were in a meeting yesterday and my director was like, nobody's more enthusiastic about economic support than Katie, which I thought was kind of funny because I do get really excited about policy and about getting out there and helping. But looking at those organizations that are out there, I know that we have a federally qualified healthcare center that's in just a town over here in Monroe County. And, looking at opportunities, like, would you like it if we could come in and sit down with the customers face to face in those areas? Monroe County is pretty rural. And so we do have that distance. And so I guess my line for getting those people on board and things like that is, like, what can we do? How can we serve you? How can we bring things to these customers, even if they're not in the county seat, the city where the county seat is? And so I think that's the thing, is getting everybody to see the benefits of these relationships and these partnerships.
Wonderful.
It's in my nature to build relationships. There is no one person that I don't meet to see how can we work together. And I've been guilty of making friends in the grocery store line and my son asking me, "Are you working, Mama?" So it is something that I just do. I can't just go to the pharmacy and hear that someone's having trouble accessing their medication without saying, "Call Forward Health. Did you get help?" That I just can't turn a blind eye. And I also like to. I'm very guilty of being too much times. Sometimes people just want to vent. So developing relationships beginning for individuals called to this day, even though roles from the time that I met them. It's never ending. I love it because it is something in my nature, but it helps me do my job effectively.
Wonderful. And I agree. I think the best way to start and build these relationships, obviously getting connected, but just having that intro conversation to get to genuinely know someone is the best way. I've experienced getting connected. So here I transition back to Allison. Thank you all for your time and enjoy the rest of the conference.
Thank you so much. What a great session. I learned a lot and really got a lot of ideas. But I'm also just so thrilled that these connections are already happening. So sounds like most people are connected to their local enrollment network. If you're not, definitely do that. And yeah, that sounds great. All right, so we have a break and we'll be back at 10:45 for our final session of the day, and looking forward to seeing you all back. And remember to leave this session and then rejoin in the new session link. Thank you.